Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. All right, Dorsey, tell me what's going on with your back.
Back pain.
Yeah, back pain. What happened?
Just soreness. When I'm working.
Okay.
Walking. At first, I couldn't drive longer than about 5 or 10 minutes.
Can you give me a little brief history about what kind of surgery you had, like procedures and stuff like that?
2014, a left L3-4 fusion.
Okay.
I have residual pain in the left knee, kind of a numbness, tingling, sometimes mostly just kind of numb. Then 2017, January, I had the right L5-S1 microdiscectomy.
So you had 2 surgeries. Okay.
Was scheduled for the 3rd one today.
Okay.
3 weeks ago, the right leg pain completely went away.
We just want to give a note here. When you decide to come and see us, you're gonna feel better before even seeing us.
Right? I knew I was gonna get treated good, so I decided to leave.
That's good. Yeah, awesome. Good for you. So currently, like, what kind of treatment you had for this other than the surgery for your back?
The back, I haven't really had any treatment.
Like physical therapy or chiropractor or something like that?
The chiropractor will work on my upper back. I don't let him touch the bottom
the lower back.
At all.
You have fusion, so yeah.
Yeah. So, well, and I just had so much pain in the L5-S1, I wasn't going to let anybody touch it.
Have you had physical therapy for your back? Or?
Oh, I did have... I tried therapy, yes I did. I went to one person and they were trying to do active release technique, which they weren't really doing it, so they kind of scraped my skin, and so I didn't go back there. And then I went to somebody who, the first thing she did some manual, like soft tissue, but she wanted me to start doing bridges. And
really?
It was right when I was post-microdiscectomy. Yeah, I had 3 sets of 3 different types of bridges. She started me at a repetition of 10, so I was doing 10 times 6, and I asked her to justify it, and then she kind of did. I said, all right, well, I'm going to tell you if I start having pain, I'm out of here. So then that was on a Tuesday. Thursday, she upped all the sets to 20, and the following Tuesday she upped them to 30. Oh my gosh. And by that point, the pain just was zapping me like crazy.
That's one of the exercises I actually avoid.
I will never use it.
I will never give it to my patient for back pain. The bridges, I will never do that because you're going to have a lot of flare-up. That will cause a lot of muscle spasm.
Yeah, I wasn't doing full bridges just because I knew, but...
Yeah.
So then I didn't do any more therapy. I've just kind of done it myself.
So that's a second therapy. Okay. Yeah. All right. So what can we do to aggravate your symptoms? I know today you took your pain medication. So can we do like some motion that you will feel the tightness so we can assess it?
I'm sure like if I did repetitive
let's just stand up and we'll try the range of motion.
You have some stuff you need to move?
Yeah, can we move this table?
I actually could, yeah.
Okay, no, not now. Just turn around facing me. Let's do side bend and tell me how much tightness from 0 to 10.
This way. I actually only feel it like maybe a 1 over here.
The other side?
I do feel pressure here. This way, probably right now maybe like a 3, but if I keep doing it, it'll get worse.
Okay, so can do flexion. You have a good range of motion. That's good. Yeah. Any problem with that?
About right there, you feel it like low, like the muscles are grabbing. Okay. And then nothing else the rest of the way.
So because I want to stimulate the symptoms. Okay, let's do, which one gonna be worse, the flexion or the side bend?
Probably the flexion.
Flexion? Okay, let's do 10 flexion and tell me when the pain goes up, but I don't wanna, I just wanna stimulate it because we're gonna do the same thing afterward.
Okay.
Okay?
So just 10?
10.
Okay. Get to do this with my legs straight. think the pain pill's making it not kick back in like it normally does.
You feel it or no?
I'm actually just feeling it where I substitute on the left side.
How much from 0 to 10?
It's probably like still like 3 or 4.
3 or 4. Do the side bending.
I'll do it against the way that normally hurts.
And actually, I'm visually can see your upper body shifting to the left.
Yeah.
And lower body shifting to the right from your hip. And is that how long this been going on?
I have no idea. I have just been working and substituting like a bad therapist.
Mm-hmm. Can you tell us about what kind of therapist you are?
Physical therapist.
Awesome.
Orthopedic.
Yeah.
Sports.
So you do a lot of work with your hands.
Yeah. So I'm like up on the table. I'm lifting legs. I'm whatever.
Oh,
yeah,
you're doing stretching.
Yeah.
How much tightness you feel now?
Probably the same, maybe 4 or 5-ish.
Okay. So I'm releasing your superficial fascia.
Cool.
Okay, I'm going down.
Mm-hmm.
I'm gonna go deep to actually get to the acrotic fascia. Make sure it's not painful, okay?
Mm-hmm.
You feel the mobility now?
Mm-hmm. Yeah.
But why they cut this big cut?
That was him. I don't know.
Yeah.
I assumed
because
that.
Because he said L3, L4?
Mm-hmm.
Okay.
Yeah.
Yeah.
But like he was gonna do. I went to him first. He did the 2 surgeries, and I was going to go back to him, and
Mm-hmm.
I did, and I said, well, what do you think? And he goes, well, what do you want to do? I'm like, you're the doctor?
Oh boy.
Tell me what's going on. So I went to a spinal surgeon up at Cedars-Sinai,
Uh-huh.
and it was good.
That's good. So I'm interested actually if we can change your shifting.
That would be
You
awesome.
know? So because, but you don't remember how long it's been going on. Is it before the surgery or after the surgery? Because I want to know that.
No, it was. January when I had the microdiscectomy. It had to be after that. I mean,
after that, it's just compensation.
Yeah, because I was still recovering and I was doing therapy on my boyfriend, and then I finally got him to the Hoag Hospital for his, and then I got really busy at work, so I was doing like I don't have AIDS or anything; it's just me.
Are you serious?
Yeah. So and I was doing like maybe 9 or 10 people.
Okay. This is not needle, okay?
No, I'm just like they're very cool instruments.
Yeah,
so.
yeah. This is.
Like I said, I researched the other guys that kind of have similars, and what's that one? It looks like brass knuckles with like half a moon of thing, yeah. And it's like, wait, that's gonna hurt me to use those.
To be honest with you, I know 2 people had trigger finger from those instruments, just because they use it. It's just ergonomically not designed. It's not designed ergonomically,
see?
You know. And
I saw your video of these, and I'm like, okay, this is the one. These ones when you're using it on people, because it just makes sense, yeah.
Yeah, like
I did the same. Is it Grafton?
Grafton.
Yeah. So they used that half metal disc thing.
Oh man.
Straight over her new scar.
Oh my goodness. And what happened?
She's like really sore and inflamed.
Well, here's the other problem I have with them, that they teach in their class, in the normal healing cycle, inflammation, proliferation, maturation. They teach in the class that we want to cause more inflammation. We want to stimulate inflammation. I'm like, it does not make any sense.
Yeah, they've got enough of it already.
It does not make any sense. Patient has inflammation. That means you're gonna cause more scar tissue from the new inflammation.
Yep.
I had a patient that had bilateral carpal tunnel after having this treatment. Ended up with bilateral carpal tunnel plus bilateral tennis elbow because they cause inflammation in the elbow. And it's sad. It's really sad. You feel this bump here? That's a scar tissue.
Yeah, you've hit a few spots already that I can feel. Good.
Okay.
What do you want me to do? The 10?
The 10. Because we tested with the 10. Okay, I want you to do something. Straight, pulling your head up and bend while you have a good posture. Yep, good. That's better. You're flexible.
Yeah. I stayed flexible for a reason. I was just frustrated.
Move, yeah?
I was just frustrated because I knew I wasn't flexible here. I'm flexible here, but my back wasn't moving. That's why I wanted to have a manual person. Yeah. So.
Did you do 10 of that?
9 or something.
Okay.
Yeah, this one feels like better too.
You definitely need to do a lot of work on your range of motion. Yeah. You have
this one for sure, right? You know, I think it appears like that. I don't think it is. I think I'm kind of like that.
Okay.
Because this is up too from the shoulder and.
Let's finish doing this one. Did you have any stomach surgery?
I had a dermoid cyst removal.
Here, up here?
It's like a cesarean scar right here.
Okay. So. I have female therapists, well, that's going to
work. Okay.
If you're comfortable.
Yeah.
Did you do 10 side bends?
Huh? Side bends, yeah.
10?
Yeah.
How you feel?
Good. I didn't feel any of it over here. At the end I was feeling just a tiny bit there, but it wasn't even, it was like not even a 1 probably. It was just that little bit of kind of pressure, that was it. So.
So what do you think about the treatment?
Nice. I found somebody.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.